Today, our guest is Dr. Jayesh B. Sanghvi, MD Homeopathy, Chairman and MD, Dr. Sanghvi's Nature Clinic, Chennai, India. Chairman, GHF Global Homeopathy Foundation, Advisory Board Member, GHF Australia, International Research Committee, Founder Trustee, Dr. Kopikar's Foundation of Homeopathy, Founder Member, Roundtable Homeopathy, Member, Core Committee, Can Stop, Cancer Support Group, Sundaram Medical Foundation, former resource person for Homeopathy, Ministry of Ayush, Government of India, former member, Special Committee, Clinical Research in Homeopathy, Central Council for Research, Government of India, ex-member, SNEHA, Suicide Prevention Organization, winner of many national and international awards. A lot of discussion are there with 40 years of clinical experience, and the subject is Miracle Cures of Homeopathy, Simplified Prescriptions for Most Challenging Conditions. On behalf of IFPH, I am welcoming you, sir. You can have the platform for the next 45 minutes. It's over to you. Yes, sir. Please proceed, sir. Yes, sir. Yeah.
Can I take over? Yeah. Thank you so very much. I see some of my good friends here. Dr. Ismail Seth, very good evening to you. And Dr. Manoj, I think we have met each other across somewhere, I think in Kerala. Dr. Sridhar Kurup. Dear doctors, dear friends, I have a lot of my friends also who are going to be joining in from all across the world. And I think I would like to first begin by thanking Team IFPH for inviting me for this wonderful program that we have been doing, conducting every day for 650 days. I think it is the most remarkable phenomenon, maybe some sort of a record. You will get into the Guinness Book of World Records, Dr. Manoj. It is remarkable. Now, dear doctors, let me take you, with the experience. Let me tell you, I am a through and through clinician. I'm an outright clinician. I've been working on various chronic conditions, like all of you, over years. Here, I would like to share some of the remarkable cases and experiences that I've had. And I have a special mantra. I will first take you across the presentation and then explain to you step by step. Dear doctors, friends, lovers and well-wishers of homeopathy, all of you are there. I'm going to explain this in a very non-medical way. Most of the times I explain my cases like a story. And I'm going to tell you the gist of things. I'm not going into the minute details of every case, but I'm going to tell you the basic gist of the case and what made me select some of the simplest remedies to bring about some of the most remarkable cures in some of the rare incurable conditions. Let me begin. First, I begin with my humble respects and obeisance to all my gurus. And it obviously, for all of us, it begins with Dr. Samuel Hahnemann. If not for whom we will all not be here and we would not be what we are. So our greatest respects to Dr. Samuel Hahnemann. And then these three are my gurus who motivated me, who taught me, who encouraged me to be what I am. The first name you can see is Dr. R.P. Patel. He was one of the topmost authorities of homeopathy. And as per some of the, and a legend, all these three have been legends in their own right, internationally renowned. But Dr. Patel, it was said that if anybody ought to get a Nobel Prize in homeopathy, it ought to be Dr. R.P. Patel. And if anybody after Dr. Kent, it was Dr. R.P. Patel. He was the man who rediscovered 50 millisibel, who discovered tautopathy and did a lot of work. Same way, Dr. S.P. Kopikar was another doyen legend with immense experience. And he was the editor for decades of the Homeopathic Heritage, the internationally known magazine. Dr. P.S. Krishnamurti of Hyderabad, he also was another renowned homeopath. So my humble respects to all my gurus who made me what I am. Now I would like to share with you my mantra. The reason I'm sharing this is because this has been one of the reasons, this has motivated me into coming up with the simplest prescriptions for the most complicated conditions. My mantra, as you can see here, is that there are simplest answers to the most complex situations in life. The day we believe so. Unfortunately, most of us, we are all taught from childhood that more tougher the situation, more tougher the answer. But I beg to differ there. I said the day you believe in the most complicated situations in your life, you will find the simplest answers. All you need to do is believe and not doubt that belief. So the same principle I applied in my practice. From day one, I have always been working on chronic incurable disorders, and mainly with greater focus on cancer, kidney failure, incurable eye diseases, and so on. So I always try to find the simplest answers, simplest prescriptions. And most of my the prescriptions you will see are polycrest remedies, which have brought immense results. So let me share with you the cases. Now, the first, I have brought this into three different groups. First are miracles of single remedy, single dose, right? This is what we call classical homeopathy. I'm not a typical classical homeopathy because I believe, every case we enter is a new world we enter in. So every case has to be looked at from a different angle. And based on the salient features you have to decide what approach you're going to take. All right. So let me begin with this first case. I've been practicing with patients across the world. About half my clientele are outside, within India and outside. And one of my specialty has been, right from my first year of practice, I've been taking cases over the phone, some of the chronic challenging cases, and treating them. So this was a case similar. This was a case of a lady from Malaysia. She wrote to me, I received a 5-page letter. In those days, we did not have mobile phones. So I received a 5-page letter from Malaysia, my third or fourth year into practice. 1983, I started practice. 84, 85, I must have received this. So in 2-3 pages, believe me, the ink was smudged because she was crying while writing the letter. In short, the story was that she used to have severe lower abdomen pains. All right, severe, massive pains, no injections help, no intravenous painkillers would help. She tried herbal medicine, Chinese medicine right in Malaysia, all possible treatments. She went to the US. She underwent 6 different surgeries for this pain. Somebody said it is related with the ovary, which was swollen. So they removed an ovary. They removed a part of her gut. 6 different surgeries. Twice, she tried to commit suicide. The first time, she was saved by a padri, by a priest. She was going to jump off a mountaintop. And the second time, she went to jump again from the same place. And then she was reminded of her 10-year-old son. She said, what will happen to him? And so for his sake, she came back. And maybe 2-3 years after that is when she has written this letter to me. So she said, you are the last hope. And do you think something can be done? So I said, definitely something can be done. She said, there is no clear diagnosis. Doctors have assumed various conditions and they have operated and done 6 surgeries on me. And my condition has only become worse. She would even faint with the pain, unbearable pain. So she said, my life has become miserable. Please help. So I said, definitely there is a hope. I will not say there is no hope. She said, you let me know, I will come down. And one fine day she came down. She was the one who came down. And she said, I've taken 3 weeks leave and come. So I took the history. I said, now we have to go in depth and try to find a rare symptom. Because the diagnosis is not there. So forget the diagnosis. There has to be something very salient in the case. And we take pages and pages. I've not put all the details here. Maybe I would have taken 2, 3, 4 pages. I used to have a case record form which Dr. Arpit Patel used, consisting of 10 pages. So we have taken all the history. Now, there were 3 salient aspects that we discovered in our case. All right. I will tell you. And before that, you can see she has gone through laparoscopic surgeries for endometriosis, married 2 months. She had a normal pregnancy and normal delivery. That was the child who was 11, 12 years old when she came to me. And all these various surgeries, you can see 87 to 95. So 6 different surgeries were done. Now, what had happened is, yes, I've not given the other details. So there were, now the remedy that you see over here is Lachesis 30. Now, what made me select Lachesis 30? What I discovered was, I must have spent 1.5 to 2 hours with her that day, because she came all the way from Malaysia, so I had blocked that much time for her. Plus, it was my initial years of practice, I could spend that time. So what I noticed was that she was talkative. Very clearly, she was loquacious, talkative. She was so much to talk, crying also once in a while, but talking. And then second, I noticed when I asked this, whenever I find a person is loquacious, the next question, once I'm confirmed that he's genuinely loquacious, then I asked the second question. I said, how comfortable are you wearing something close to your neck? We all know this about necklaces, right? So this is to confirm a remedy that came to her mind. So she said, yes, I can't wear anything close to my neck. And being an Indian, sometimes you wear chokers of jewelry and all that. So she said, I cannot wear anything close. I'm very sensitive. Then the third question, when I find that there is a sensitivity around the neck, if it is a gentleman, I will ask that if you have to wear a tie, how comfortable are you wearing a tie? If you have to attend a meeting and once the meeting is over, what would you do? He said, no, then I untie the top button, I will loosen the knot. If it is a lady, she'll see if however costly jewelry I'm wearing around the neck, the moment I get into the car, I will remove that jewelry. Or I will buy a t-shirt which is one size larger in the neck. So why I'm explaining this is just 3 symptoms I look on for selecting the remedy lachesis. Lachesis has n number of symptoms. Like I said, I believe in simplifying. And now I'm telling you with this great confidence because I have 40 years of experience. And I will show you 2, 3 other cases of lachesis, how these 3 symptoms alone have helped me select the remedy and the miracle they have wrought. And to select these 3 symptoms, what is very important, friends, is that these 3 symptoms should be very predominant in the patient. The loquacity should be very predominant. In some cases, what I found, what I discovered, this is very important, I would like to share. They said, no, we don't talk much. When we are in a party, unknown people, I don't talk much. Then the next question is, okay, what if you are with known people, your family, your friends? The next question is, they will straight away say, yes, with them, I have so much to talk and so much to share. This is also loquacity. So loquacity, if loquacity is there, the next question will be, how comfortable are you with anything close to your neck? I've had gentlemen who buy one size larger collar neck shirts. If they have a 15 size collar for the shirt, they'll buy a 16 size because they can't be, if they have to wear a tie, they're not comfortable. So that is sensitivity. And if this physical sensitivity is there, the next question will be emotional sensitivity. Will you get offended easily? Are you hurt easily? And most of the time they'll say, yes, I get hurt, I get offended by these things. So the moment these 3 symptoms are there, the remedy is lachesis. And lachesis being a very sensitive remedy. See, these 3 symptoms are predominant in lachesis and predominant in the patient. Lachesis 30, one single dose was given to this lady. And I said, you go back. She said, no, I have taken 3 weeks leave and come. So I said, okay, stay back for a week and go because you have suffered for so many years, 10, 12 years, 6 surgeries. So I don't expect a miracle in 2, 3 weeks. You go back and then maybe before 1 year, I don't want you to judge, give me 1 year time. She said, okay. She came back the 5th day. She said, doctor, I feel my pains are a little less. So I said, are you sure they are a little less? She said, yes, definitely. I feel there's a 5-10% relief. But that relief could be because because I'm on a holiday. So I said, do you take holidays while you are in Malaysia? She said, yes. So when you take a holiday, are your pains better? She said, no. So, all right. So mentally, I did feel a little happy, but I didn't jump to a conclusion. After that, she must have been treated for about 10 to 12 months. She had 2 minor episodes of pain between the first 3-4 months. After that, no pain. She was in touch with me for 10, 12 years. After 2 years, she flew down with her son and then with her husband for their treatment and all that. Now, the remedy given was only 1 single dose of lachesis 30. Other remedies, I do give in 201 ml also, and I give a single dose. But lachesis, I believe, because lachesis is 30, lachesis is sensitive. And because the patient of lachesis is also very sensitive. So 30 potency also will work like a high potency in a sensitive patient. So this is the first case. And then we have another case from US. All these are cases of the 1990s, early 90s, 83 started. This was in 1992 or so. These people called me from US. The father called me. They said, my son is 11 years old. And he has been suffering from unbearable leg pains. The last 3 years, he's bedridden. He was an athlete all his life in his early days. He's bedridden. He has undergone all possible checks because my elder brother is an allopathic doctor in the US. So he has helped me do all possible investigations, necessary investigations, unnecessary investigations. Then he said, I've come down to India. I've tried homeopathy. I've tried Ayurveda. Nothing is working. Somebody has referred, please help me. If required, I will come down to Madras or Chennai for 3 months or 4 months, whatever you want. So I said, no, I don't want you to come down now. Let me first take his history. And then I will tell you whether you need to come immediately or we will wait. So I took down all the history, again, the same few pages of history. Now, again, the salient features over here, if you notice, aggravation by the slightest touch. The father told me while giving the history, he told me, he said, I'm going to touch my son's leg. And you please see his reaction. So he must have touched his leg, and the child shrieked out as if he's being murdered. Somebody stabbing him. He said, this is the agony the child is in, and I cannot bear to see him suffer. 3 years he's been suffering like this. So I said, all right. And then we found out that he has aggravation soon after sleep. Now, see, friends, what I want to tell you here, I'm telling you these symptoms so easily, but I verify these symptoms with the patient in 3, 4, 5 different ways. I will ask him question and cross question him to be very sure that the slightest touch aggravated the pain, to be very sure that the sleep, there was aggravation soon after sleep. He said the child is sleepy or he would go to bed and then suddenly he wakes up with massive pains. And he was talkative. I spoke to the child for a while and he was going on and on and going on to various subjects also of his interest. So these 3 symptoms, I analyzed for 24 hours and then I had asked him to call back after 24 hours. I said, you don't need to come now. Give me 3 months time. If in 3 months he doesn't start feeling better, then come down to Chennai. We sent him a 6-week course from here to the US. The real medicine was only Lacus-30 single dose. Single dose. Rest Saclac, placebo. And after that, what we noticed was that maybe after I had asked him to report back after a month, he called me after 3 weeks. I said, how is Rohan? He said, well, doctor, I've called you 1 week early only to tell you that he's playing outside. I said, what do you mean he's playing outside? He said, yes, he's playing outside. He's 45% better with the pain. I said, good. We just continued, only placebo, all the way through only placebo. Maybe after we must have treated for a year plus, because even after the patient is 100% normal, recovered, I believe 100% external recovery is 80% internal recovery, because there's no barometer or no investigation which you can judge that the patient is 100% okay. So after the patient is 100% okay externally, I still work for a few months, 2, 3 months, 4 months, and then only stop the treatment. So we also treated the child for more than a year. And they were in touch with me for a long, long time. They would come to India, they would come down to meet. But that condition never occurred. Diagnosis, no diagnosis. Cure, yes. Homeopathy, Lacus-30 single dose. This is another remarkable case very recently. She's the mother of an eye specialist based in Chennai. She lives in Punjab. 79 years old when she came to me. There was a leakage of the left AV valve, arterioventricular valve. And the doctors at Apollo Hospital, which is the largest corporate hospital of India, the topmost cardiologist, there is a very special technique called clipping that is done. Since the last 3-4 years, they have started. So at that time, it was just going to be introduced. They clipped the valve so that the leakage is minimized. The procedure cost 50 lakhs, as you can see down there. So the doctor had told the cardiac surgeon had said that she requires clipping, with which her quality of life may improve a bit better, because she used to get, as you can see, multiple anginas. She would get distinct with the slightest exertion and extreme weakness. And this was going on since 2-3 years. EF, ejection fraction, as you see, is only 45%. And before that, just few months before that, she had gone through angioplasty with 3 stents, but that also had not made any difference in her condition, major difference in her condition. So they had about 1 year, I don't know, a few months to 1 year time for that new procedure to start over here in India. So with that thought, they had come that if homeopathy helps, we'll give it a try. So again, we went to all the details of the case and analyzed everything. But 3 symptoms, as you can see here: loquacity. She was so obviously loquacious, laughing, joking, and talking all the time. She would not let her son talk also easily. And then sensitivity around her neck. She said the least, I cannot, however cold, Punjab cold also, I cannot have a muffler or a scarf around my neck. I just cannot. Okay, I can't wear turtlenecks when I go abroad. So sensitivity was very clear. Then this sensitivity was there. I said, emotionally, how sensitive are you? Do you get offended easily? Do you get hurt easily? She said, very well, doctor. For once I will get hurt. After that, I may think that maybe I should not have got hurt, but I get hurt very easily. So the 3 principal symptoms of Lacus is loquacity, sensitivity around the neck, and then emotional sensitivity. Medicine, Lacus is 30 again, one single dose. I've not even given 200. I've given only 30, one single dose. In about 1 month time, she said my dyspnea is less. The angina's frequency has reduced by about 50-60%. By about 3 months time, she was working outside in her garden. In about 6 months, within that 3 to 6 months, she must have called me 3-4 times. She said, "Doctor, I've started work. I go for shopping also." And by 6 months, her words were that I have been working the way I have never worked in my younger days. Friends, in just 6 months' time, one single dose of Lycosis 30, and it was a miracle. Miracle for me also. And I was 36 years into practice, 37 years into practice. I was still surprised with the way amazingly how our medicines work. And after that, now it is still since 2018, 4 years, getting to be 4 years. She calls me once in 3-4 months only to say that I am working like a young person. I have no problems. I thank you every time. I pray for you every time. So we don't want the thanks, but it gives us great happiness when we see how our medicines work these miracles on you. And simple remedies, friends. And there are simple ways of, see, all of you from your experience, haven't you come to certain conclusions on selecting remedies? Earlier, we would always repertorize every case. We would go in depth about all cases. We would take so many symptoms into consideration. Then you learn that each remedy has certain symptoms which are specific of that remedy. So if those symptoms are very strong in the patient and as equally strong in the remedy, please prescribe that remedy first. And you will be surprised the way it works. And there a single remedy, single dose is enough. I have also used multiple remedies. Believe me, I have no qualms about that. I will come to you on that later. Now, this is, I will quickly go, I think. Dr. Baru, tell me how much time we have, or when let me know 5 minutes before, because I have, I think, quite a few cases. So yes, I will cut short where I have to.
You can continue up to 8:45, sir. Followed by we can have a discussion for 15 minutes.
8:45. Okay, so we have about 20 minutes ahead.
Yes, sir.
All right. Now I will quickly go through. This is another case of a physically and mentally retarded child. He was 3 years old when they came. My very first year of practice, rather the very first month of practice. He was referred by a giant saint. They were diamond merchants from Bombay, and the mother was from Chennai, so she had come for a holiday. And they had been to US, they had been all over, they had been to homeopaths, our very senior homeopaths. I do not give the name, but senior, most very respectable homeopaths in those days. And they had been to Delhi homeopaths, they had been to Bombay homeopaths. So for me, this was a challenge. And I was a fresher, a few patients coming every day. So I told myself, I said, I have to spend, I spent about 3 hours or 3 hours, more than 3 hours with this mother getting the history of this child. And this child was like a rubber doll, friends. He had no strength. He was 3 years old, but no strength in his spine. He was just slouching like that. No recognition. He knew what, there were no emotions. He didn't know anything. He didn't understand anything. He didn't know his parents. He didn't know anything at all. And he would just make some vague sounds. And he used to suffer from severe epilepsy. The doctors in the US had put him on to a near adult dosage of epileptic drugs in those days. So we went into the history, everything, and I told myself, I was reminding myself constantly that some of the senior, most respectable homeopaths of those days had had treated this child. So I said, God, help me find somebody. I always begin with a prayer, believe me. Whether we believe in God or not, each of us, we are taught to believe. So that brings out, awakens our inner powers. God is just it's just a channel in the name of God. But when you pray and with sincerity, when you ask, it's amazing how the universe gives you the answers. So I took the complete history, 3 hours we were talking, discussing, trying to find out something rare. Something very unique came up. And the mother repeated that particular thing 3 to 4 times in her talk. When she was 8 months into pregnancy, she saw a horror movie. Now, normally during pregnancy, all advisors, elders, especially in India, they advise, read religious books, read good things, listen to good things, There's a reason behind it, because whatever you see, read, hear, impresses the child. So this lady went up seeing a horror movie. Not only she saw a horror movie, that fear lasted for 3 to 4 weeks, she said. She was so terrified after seeing that movie. Now, this struck me. He said, after effects of fear, which remedy? You see at the bottom, opium for chronic fear. So the first thing I said, there are a lot of other medicines like Berita, this, that, you treat pathologically or based on the symptoms of the child or the family history, the past history. But the first and most salient feature, because the mother was repeating this again and again, and it took her 3 to 4 weeks to recover. Now, I gave one dose of opium 1M, just one dose of opium 1M, and gave only placebo. And I said, after a month, you report back. By that time, I thought that I will spend more time, think over what are the remedies there are for children who are physically and mentally backward and all that stuff. After a week, after about a month, when they call up to give a feedback, they said, Nimesh, that's the name of the child. He said he's lifting his head. He's able to sit upright now comparatively. He's able to hold himself. And he said more than that, we are extremely happy he's recognizing us. When he sees his father or me, he tries to smile. He tries to make sound which are very specific only for us. They said this is something that is remarkable. And we gave only occasional doses of opium, maybe once in 3-4 months or something. We treated the child for about 2 years. And there was a remarkable change. Normally, these children don't live long. They die normally, 10, 15, 20 years age at the max. This child lived 28 years with homeopathy. From 12, 13 years, there was no touch after this treatment that we did for this child. By the time he had reached a phase where he was as normal as you and me in understanding and explaining and all that. Only thing is his language was still held back. He could not speak everything very clearly and all that. And he was totally bedridden, being totally spastic. After this, I will come further. We saved this child 3 times from deathbed. One of my other specialties working on deathbed emergencies. I will come to those cases. This is another case of, I think I will go fast because I've taken a lot of time in these cases. This is a child who was, again, an ADHD case, very poor attention span. And more than that, he was so hyperactive and restless, screaming and beating other children and all that. So it was very difficult to handle him. Very, very difficult for the mother. She can't go with him anywhere. Now here I will come to the gist of the whole case. There was the mother at 5th month got diabetes. She tested positive for blood sugar levels. And there is a strong history of diabetes in the family. Maternal grandmother, paternal grandmother, paternal grandaunt, paternal granduncle, maternal aunt. So in the 3rd generation, a series of people with diabetes. Now this is another, my 40 years of experience that I'm sharing with you, another secret, I would call it. So far, I have once or twice divulged over the webinars now, but a very simple way to decide on a particular remedy where a single dose, that remedy normally is used as an intercurrent, all right, because it is a nosol. But here we find that it can be used as a curative and a single dose is enough. And for that, all you need to know is that there should be a strong family history of diabetes and a strong family history of cancer, or a strong family history of other diseases also, but particularly if there's a strong history of a strong family history of diabetes, a strong family history of cancer. The remedy, friends, is carcinosin. And this I learned from senior Dr. Shankaran, Dr. Rajan Shankaran's father's booklets, which taught me. And then I started adopting that. His booklets are marvelous. There are amazing clinical tips given in these books. That maybe subsequently when I talk with you all, I will talk on that someday. But now this child was given carcinosin 31 dose. And I have carcinosin cases from A to Z conditions. I have given carcinosin. If these symptoms of family history of diabetes and cancer was strong. If not, as a second choice, you can go for frequent history of autoimmune disorders or heart conditions or any other condition that is strong in the family. Then first give a dose of carcinosin in weeks. You can give 30, 200 or 1 I give a dose of 30 over here. You can see within a few days or 2 weeks or something, it said the child, some positive signs started being noticed. He started taking new food. Earlier, he could not tolerate certain type of foods and he would not take also. Further down, you can see he's better in focusing. His reflexes have improved. He went on to carcinosin 200, it's a subsequent dose. And then restlessness in class much better and much reduced, says the teacher. That treatment went on to 2019. Comprehension was better, doing very well in his studies, reading and writing both. Where he would not even sit to listen to the teacher, he was reading and writing. And overall, a remarkable improvement. The family was so happy. After that, so many members, patients they have brought. This happens to all of us, right? But this, I'm just sharing my experience. Each of you would have such remarkable stories to tell. But how amazingly and how in a most simplest way you can select the remedy carcinosin. I will show you one more case and quickly I will go to the next subject. This was a case of callosities in the left foot. It was severe cause. I will show you the photograph. But if you see the family history, and for 6 months, the patient went through laser treatment. It came back again, very painful. Even pus was forming. They were getting into septic state. And they were relapsing. Twice they have got them removed, laser and whatever, surgery or something, but it recurred. Then they contacted me. This patient was in China. His father, mother have been our patients. So they said that please help us. This child is suffering so much. We looked into the history. There was a strong history of family history of cancer and diabetes, both. That was enough to lock in the remedy. The first prescription we send has to be carcinosin, and then we'll see. If we don't see the result, we'll decide the next remedy is whether it's anti-crude or hypericum or Ranberg, whatever. So you can see, based on the strong history of autoimmune disorders. Now, diabetes also, as per the latest study by WHO, they consider type 2 diabetes also as autoimmune. Type 1 is autoimmune, but type 2 is also considered autoimmune now. In 3 weeks' time, all the callosities disappeared. I told the father, I said, give me 1 year time. Don't judge before that. When I say 1 year, the patient will stay for 6-8 months at least. Within 3 weeks,
Excuse me, Dr.
you can see the
Jayesh.
photographs.
Dr.
Yes,
Jayesh,
Dr. Manoj.
you can
Yes,
have another session. No need of hurry, doctor. You can have another session.
Yes. We'll do that. We'll do that.
Yes.
All right. So we have another 10 minutes, right?
Yes, sir. Yes.
10 minutes. Okay.
Yes.
10 minutes. Okay. So these are deathbed emergencies. I will go through this later. We'll go through all this. Now I'm going to give you, in 10 minutes, I will talk about a few cases on some diverse challenging conditions, various challenging conditions.
Yes.
This is a very unique case from Dubai. They contacted me over the phone, March 24, 2010. This lady was a British lady married to a Russian gentleman. And she had what is called a unicornuate uterus, which is the result, which results in infertility. The gynecologist had told her that you cannot ever conceive. She was 8 years into marriage. This uterus is so small that nothing can be done. And if you ever do conceive, you will abort. So the day she called me, she said, please help me. There's nothing, no hope otherwise by the doctors. I would like to give it a try. So then she said, I missed my periods today. Can I call you tomorrow? I said, call me. Next day she called me. She said, I'm pregnant. But she was wanted my help to get pregnant. But then she had conceived. Then she said, doctor, you please help me today. I have no other hope. She said, last night, once I was confirmed as pregnant, I visited my gynec. And gynec was extremely upset with me. She said that, why are you spoiling your health unnecessarily? You will abort in 2 to 3 weeks. So now you're the only hope. Please help me. I said, I was asking you 1 year to help to strengthen your uterus and then give it a try. I said, I wasn't promising you anything there. And now you have conceived and you want a result now. This is the other only hope. My man is coincidentally, he's in Chennai today. He's flying down by evening. Please give whatever you want. I want to go. So we were also dismayed. We've never seen a case like that. So we started searching the repertory. Now you see below, look right below, Murphy's repertory, female atrophy uterus. All right. Now, how to interpret unicornuate uterus? So atrophy uterus, 2 remedies, iodine and plumber. Female pregnancy, miscarriage in non-development of uterus cases, which is again very similar. So Beretta carbon plumber med. So the common remedy was plumber med. So we gave a plumber med 0/3, LM potency, and she was put continuously onto that. 2 weeks over, 4 weeks over, 2 months over, full pregnancy. The child is 12 years old, friends. The remedy that saved, the doctors to this day say that this is a impossible case. I've never seen a case or never read about a case anywhere in any journal. This is another amazing effect of our medicines. A pancreatitis, I'm going to skip this case. This is the case of transitional cell cancer of the urinary bladder. 32-year-old gentleman, son-in-law of an allopath who was my patient. This is the year 1990. The allopathic doctor, patient of ours, he just barged into my room that day, I remember. And he said, doctor, these are the reports of my son-in-law. He has been discovered to have transitional cell carcinoma of the urinary bladder. He was bleeding for a month. The doctors thought it is UTI. Finally, they did an ultrasound and discovered there's a 1 inch tumor. They have operated the tumor. Within 3 months of removing the tumor, there is a tumor larger than the one removed in the bladder. The doctor said now they will not touch. And for some reason, they said he cannot be given chemo. There was some reason. So he said, now you have to help me. So I said, you have already operated. In 3 months, this tumor has grown larger than what it was. I said, I don't know how much I can help you. But he said, you are the only hope, please start. So prescription you can see. Calcareous carb and thuja. This case completely reversed. 1990 and this is 2022. The patient is happily living in Canada. Every 2-3 years he comes to India, he talks to me. The reason why we selected calcareous carb, look at, in those days there was no Murphy, we would look at Kent's repertory. Kent's repertory, bladder tumor, one single remedy mentioned, calcareous carb. Calcareous carb, and whenever, I'm sorry. Yeah. Whenever there is a single remedy prescribed against a rubric, that remedy, even if it is of grade 1, it has immense value. Calcareous carb and thuja was given. I'm not going into details of how, but I think if I remember right, in about 15 months, the tumor had disappeared completely. After 3 years, there was a recurrence of the tumor. And this is some very important point I would like to share with you, because 3 years went by normal. Every 6 months, he was in touch with the oncologist. Investigations are normal. Once when they came for the medicines to be collected, I did not have calcareous carb 03. I always give a 50 millisieverts potency in cancer. LM potencies work much better in cancer than the normal centisibel. So that day, I did not have calcareous carb 03 in stock. So we said, chalo, around 3 years he's gone on, well, let me give calcareous carb 30. So 3 months course was given of calcareous carb 30. Believe me, after some time, there was a recurrence of the tumor. So I was stunned. I said, what happened? Then it struck me. I said, I changed the potency. We went back to 03. Another 3 months later, that little growth also disappeared. We must have treated her for 7 years. To this day, by God's grace, everything was good. And the remedy is only calcareous carb selected based on the rubric, and thuja as a miasmatic, anti-miasmatic. All right. How much time we have? Okay. It's a lymphoma case. I'm skipping that. There's another cancer case. I skipped that. Quickly, I'm coming to a. Yeah, this is one of my other specialties that I work is on incurable eye diseases, friends. So this was the case of a gentleman. I will quickly finish. This is the case of a gentleman who was about 74 years old, if I'm not wrong. He had come for a trigger finger. Somebody had suggested that he had come for a trigger finger. While talking with me, he said, doctor, I also have a block in my carotid arteries. The way it happens, and the doctors are worried. I'm 74 years old. The block is increasing. And if it gets completely blocked, how it's going to impact my brain, if I go brain dead or whatever. So he said, but there's nothing doctors can do. And they can't operate. They can't operate also. We at this age is what they're told for various reasons. So that was while telling the history. He wanted medicine only for the trigger finger. So I told him, I said, we have certain remedies that can help you here. If it is okay, let me treat you. When I'm treating your trigger finger, I will treat you for that also. So he said, okay. Now, we started the medicines. All right. So we had to give him. You can see the Doppler shows that carotid, there is a 50 to 60% narrowing of the left carotid artery. All right. There's plaque formation, 50 to 60%. Stenosis of the right carotid artery, also 30% block. Both the bilateral block, basically, of the carotid arteries. Now, the remedies we selected. This family history is insignificant, just showing here. This is also okay. This is also not important. I will show you the remedies prescribed. Now, this is a multiple case of remedies. Calcareous carb is very good in removing plaque formation from experience we have found. So, calcareous carb 0/30 was given weekly once. Ruta 30 for the trigger finger. Vipera 01 is a very good remedy which helps to form collaterals when you have a heart block. We have cases where many times bypass surgeries also have been seen. Occasional cases, not every, but occasional cases. Vipera is tremendous to help in bringing on the collaterals. So Vipera was given for this to help him with the carotid block. And Kratica 01 is again a remedy that I give for all kind of blocks, arterial blocks. It removes plaque formation, as we know, and so on. So at that stage, we didn't want to take a chance because this plaque formation was going on at a fast pace. So we started these remedies, like you can see, calcareous carb 0/30 once a week, Ruta twice a day, and Vipera 3 times a day, and Catechus 2 times a day. the calculator to improve circulation. The reason why we gave these is also mentioned here. And what happened? Now I'll quickly come. After about 6 weeks, when one of my assistant doctors was taking his history over the phone, most of our patients report on phone. I see them only once in 2-3 months. So the patient said that my vision has, the assistant doctor brought a note saying that the patient's vision has improved by 10-15%. So I said, there's nothing mentioned in the history about vision. Did he have an acute infection or something? So I said, you ask, because if I'm not satisfied, I will not prescribe the medicine. So I told my doctor, go and find out who the patient. So when she asked the patient, she came back all astounded and with a big surprise and a smile on her face. She said, doctor, 40 years back, this gentleman has lost vision in one eye. He has even forgotten that he doesn't have that eye. That's why he's not mentioned in his history. He had repeated retinal hemorrhages in those days, somewhere in 1968 or something like that. For 3 years, he went right up to the US for the next 10 years. He tried everything. The doctor said, forget, there is nothing much that can be done. You just have to live with that. So all he could see was a thick haze, like looking through thick mist. He cannot differentiate light. He cannot differentiate anything. In that blind eye, after 40 years, there is a 10 to 50% vision back. I said, now call the patient, take the complete history. We took the complete history, but as you can see, we never changed the medicine because when the patient responds, do not change the medicines. Later, you can see Thuja, whatever was given, but that was for his prostate problem that he had. Otherwise, the remedies remained the same. He was steadily improving. In about a year's time, his vision was 50% better, you can see. And about 2.5 years' time, he got his vision 100% back, friend. After 44 years, 100% vision back. The Shankar Nethralaya, which was the second largest eye institute in the world, is based in Chennai after the Boston Eye Institute. The doctors there were so shocked because they used to regularly see him once a year. They were so shocked. And this is nearly in 2008. To this day, he's my patient. He's in his 80s. He comes for whatever other problems that he has. This is the miracle that homeopathy is capable of making. And I was not treating for his eye. I was trying to open up the blood circulation. Maybe the Vipera has the power to dissolve. Calcarea carb has the power to dissolve clots. They dissolve those clots which are there since 40 years. And the vision back 100%. So this is a trend. I will end here. Let me quickly end this. Sometime again we will do this. So thank you so much. I thank you all for a patient hearing.
You had given on dose of medicine, on dose of 30.
Yes.
Yeah, and you are waiting for you have that much confidence in homeopathic medicine. How?
Yeah, correct. No, I began with 2 remedies, 3 remedies. When I started practice in 1983, I was like a rudderless boat. I had nobody to guide me. But one desire that, yes, I want to be a homeopath, a good homeopath, and take challenging conditions. I used to use, because that time, the patient, it does not matter whether you're using 1 remedy, 3 remedies, or 2 remedies, or 5 remedies. The patient wants to feel better. Right? So here I started with 2-3 remedies. Then I came across some books where I heard that single remedy, single dose also works. Then I started experimenting, Dr. Herbert. And from that, I discovered that when there are strong mental symptoms in a patient, the mental symptoms are strong, and those symptoms should be equally strong in the remedy. Then I would prescribe only a single dose of that remedy in a 200 potency generally. And then the result, we didn't have to wait months. Mostly within 2 to 4 weeks, the result would be there in the chronic condition. Result means the initial improvement, something to tell you that you have hit the bullseye. So in all these cases that I told, including the first case of Malaysia, where for more than 12 years that lady was suffering from pain, 6 surgeries, within 5 days her pain had started reducing. Now that little indication is, I did not jump to conclusion in 5 days because a 12-year-old case with 6 surgeries, I was not anticipating. I had told her before 1 year you should not judge. And you may feel better in 1 month, 2 months, 8 months, time will tell us. So, but within, at this time, over years, I have seen when the medicine is, especially if the remedy is prescribed based on the mentals of our patient. But you have to be very, very sure that those mental symptoms are very strong in the patient. And those symptoms should be equally strong in the remedy. Then the same like loquacity, for example. So the moment I feel the patient is loquacious, I will ask him in 2, 3, 4 different ways about his loquacity. When you're in a party, what do you do? Do you listen more or do you talk more often? I said talking is also, see, many patients are hesitant telling you that they are talkative because they feel embarrassed. So at that time I tell them, see, talking is also an art. Everybody cannot carry it off. Then they say, yes, I do talk a lot when I'm in a party. So does that happen when you're with friends and family? Yes. So your loquacity is locked. If loquacity is there a sensitivity around the neck? Yes, you find that 80-90% that sensitivity is there. You ask about wearing a jewelry or a dress. Or if that physical sensitivity is there, my next question is emotional sensitivity. Now, to derive these three rubrics to select lacuses, these symptoms or lacuses, it has taken me maybe 3, 4, 5 years to conclude with these things. That I'm sharing with you in a single platform, this webinar. So this is how I started selecting, but still there are cases, I would say at least 20-30% cases where, or 30-40% cases where we give multiple remedies. Because the ultimate aim is patient will not give you clear symptoms. And I have spoken to some of the topmost, if you have the time, I'll just tell you, I was talking with Dr. Sarosh Wadia, Dr. Wadia, the senior most gentleman, Dr. Shankar and Dr. Wadia, Dr. Harish, they were all contemporaries, Dr. R.P. Patel. So as a student, final year student, I was one whole day with Dr. Sarosh Wadia. I said, sir, when people call you, do you give more than one medicine? He said, yes, Dr. Jayesh. There are times when we have to give more than one medicine. A patient, in those days, only phone calls, trunk calls, you have to do a trunk call. He said, a patient will call me from Delhi and say that, doctor, I have fever. I can't ask him half an hour of questions. So I would say, okay, go and take biocompetition number 11. So this is from a senior homeopath. So I have met a lot of, in my early years, I met a lot of senior homeopaths. Those days, see, we are not diverging. Unfortunately, those days, they never diverge much. So, from morning to night, run after them, you'll get 1 or 2 clues, clinical clues, which will change your life. So what he said, I do use more than one remedy. And single remedy, lot of cases, single remedies, provided I'm convinced about the symptoms that I have, and mostly mental. I don't go into anything else there.